Dr. Blake's Taker here with Susquehanna Spine and Joint. Today we're going to go over some unconventional things you can do to help alleviate your knee pain. A lot of knee pain comes from the knee not tracking properly. A lot of times when you injure your knee, what happens is this middle muscle here, this kind of shuts off, and this outer quad overcompensates. And over time, this is going to get really tight. It's going to throw off the tracking of your patella as well as the mechanics of the knee. So what we want to do is we want to stretch out this muscle here. And you want to do more than just a traditional quad stretch. So that's not stretching this specifically. It's just it's a global stretch. You want to really focus on stretching this, and we use a roller to do that. When most people roll, they kind of roll with their legs straight out, and that's okay, but it's not as effective as if you put tension in the muscle. So you want to bend it, make the muscle tight, and then roll. It's going to be a lot more effective because it pulls it tight, and then when it rolls, it's going to really help break up the adhesions. So let me demonstrate that for you. So let's get a roller. You can kind of plant your hands, feet. That's the traditional way of rolling it. When you bend that knee, that puts that quad in tension, and it pulls it tight, and that's going to really break up those adhesions in the knee. You really want to focus on rolling the outside, as well as you want to focus on rolling right above the kneecap. That's going to get really tight there also. So for that, you can keep that leg bent. You're going to roll it. You can also kind of do it where you compress it, and then you're going to pull your leg through. So you compress it, and you're going to bend that knee, kind of floss that muscle. Find the tender spot, compress, and then bend and floss. So that's how you loosen up this portion. And the next step we want to do is we want to get the swelling out of the knee. So how you get swelling out of the knees, you want to use compression and muscle contraction. So to do that, we use some floss as well as a pro stretch band here. So we're going to hook it up here. Then we're going to apply the floss. The reason why you do the compression is because the more you squeeze, it's going to push the swelling back into the lymphatic system, and that's what's going to clear it. So you push a foot into the lymphatic system, then the muscle contraction is going to pump it out, get that swelling out of the knee, and helping with the knee pain. So you start just below the knee. You're going to wrap it towards your heart, overlapping about ½ inch. Just tuck it in there, and there you have that nice compression. And there's a couple ways you can do this. You can actually just use it to floss this out a little bit more. When I say floss, to remove more of these adhesions. So you roll it tight. Then you're going to go through a full range of motion. That's going to kind of help stretch and pull it out. That's to kind of loosen that up, remove any of the scar tissue you might have. So the next step to actually pump out the swelling is we're going to do these terminal knee extensions. So you're just going to have the band, it's going to pull the knee bent, you're just going to straighten against it, just like this. So there's a couple things. It's going to contract the muscles, as well as it's going to compress and push out that fluid. One thing what's nice about this terminal knee extension, your terminal knee extension is going to work that middle quad, and this middle quad I talked about earlier, that kind of shuts off when we injure the knee. So you're going to do this probably for about 2 minutes. It's just simple, straighten the knee and flex the quad. Once again, the compression from the band itself, the floss, is going to push that swelling out, as well as the band, the pro stretch band here. It's going to allow you to contract that muscle, and just compress it and push that swelling out of that joint, as well as work that middle quad. So once again, do it for about 2 minutes. That's why as long as you want to keep the compression floss on here. And you can do that every day. That's also a really good way to warm up your knee before you do any kind of squatting or deadlift. Make sure it's nice and warmed up so you can do a more aggressive rehab. So for a free consultation, give us a call.